With my Dean McGee Eye Institute hat squarely in place, let me say that I'm extraordinarily proud of the accomplishments of all the staff, physicians, and researchers, and of those on the Board of Trustees, in the community, and in the College of Medicine, who ensure success by their talents, their partnership, their generosity, and their leadership. Now, with my American Academy of Ophthalmology hat in place, I must note that in the last 10 years, the 32,000 Global Academy members have elected 3 Dean McGee ophthalmologists as president. Dean McGee embodies what is felt to be the very best in our profession. We should all take great pride that tonight we celebrate an organization that not only leads ophthalmology here in Oklahoma, but around the world.
My first memory of the Dean McGee Eye Institute was as a model in my house, and it sat on the dining room table. And if I ran my Hot Wheels track over the Dean McGee Eye Institute and then the dining room table, I could get a couple of loop-de-loops out of the car before it stopped. And then when I look at it now, and it's 2 pavilions, and it's a leader in research, and it's a leader in residency training, and it takes care of all Oklahomans. I just find it phenomenal, and I think, it's traveled so far from its humble beginnings as a model on the dining room table to what it is today.
The most unique thing about Dean McGee Eye Institute to me is its structure. It's a partnership between the community and the university, and that doesn't exist many other places. The clinical operations clearly are largely dealing with the community and provide outstanding service. The University of Oklahoma School of Ophthalmology brings much credibility to our clinical operations. And then in the research function, that's really a partnership. The foundation and the donors have helped make our research that emanates from the Institute amongst the best in the world.
The Dean McGee Eye Institute provides a tremendous amount of patient care for diseases ranging from common eye diseases to the most complex, difficult eye diseases that can only be treated in a highly specialized eye center such as the Dean McGee. They're also working towards discovery of new treatments and perhaps cures for eye diseases. And they have a mission of education and training, residency training and fellowship training. That's how I see the Dean McGee Eye Institute as paralleling and aligning very well with the 3 great missions of the medical school.
Dean McGee has an incredible mission when you think about it. It's a simple mission: to save and enhance people's eyesight. What a great gift. And to do that both by individual patient care as well as doing research that has the potential to help people's eyesights literally around the world. I can't think of a more noble calling.
It stands out as a resource for all Oklahomans. The OU Health Science Center is proud of the Department of Ophthalmology. And the Dean McGee Eye Institute, as you know, has a renowned tradition of training for ophthalmologists. Students and trainees come from across the country to learn here from our faculty who are experts in their field, to train side by side. As you would expect, they do fantastically in all training benchmarks, ask the questions, and push the frontiers of ophthalmology forward.
I've been at least aware, associated with the McGee Eye Institute almost from the beginning. And we have been blessed with incredible leaders, from Tommy Akers to David Parke, and now Dr. Scuda. And a 5-star person in Gene Anderson in research. And you just can't beat him. And he's attracted more people. And 5-star players attract more 5-star players. And success begets success, if you will. Sky's the limit.
The Dean McGee Eye Institute is well respected all over the world. The quality of the science here matches the quality of science done in any other medical center in the world. We have scientists that work on the retina and retinal degenerations and retinal diseases. We have world-class immunologists, a biomechanical engineer, trying to bioengineer corneal stroma, that is to make a new cornea that can be transplanted. And the cornea could be made from the person's cells so that there wouldn't be a problem with rejection. So there's an awful lot going on here.
The Dean McGee Eye Institute, when you ask a question about all the different ways that it enhances the community or its impact upon the community, one of the things that I like about the 40 years is that the Dean McGee Eye Institute has remained innovative. It works with the best practices throughout the nation to ensure that Oklahomans are receiving the best care, the best research, and then we share those best practices and travel globally. Not only do we be able to educate doctors around the world to treat the poorest areas, but the knowledge we get from those poorest areas help us with the compassion that we have with the Oklahomans and everyone we get to serve here.
Education has always been a very important part of the Institute. In fact, it was one of Dr. Akers' main priorities, and he strove to have a strong residency program. He and his successor, David Parke, were very successful in so doing, and by the time I came to Oklahoma in 1999, this was already one of the best training programs in the country. We're in a situation where we have to take something good and make it even better. The number of applications for our residency program has gone up from about 325 to 425 annually just in the last 5 years. So that means that the majority of U.S. grads who are pursuing ophthalmology are actually applying to the Institute, which is phenomenal. I really believe we're a top 10 program, and I have every intention of trying to move us into that metric over the next 5 years.
Since its founding in 1975, I came to learn about its reputation. I was a patient, my wife was a patient, and I confirmed what I'd heard from all those people for so many years, and it was a place that had a DNA for compassion and care. And not only was the work terrific and quality, but the care that they exhibited for their patients was phenomenal. It's a true point of excellence for our city, our state, and the country when it comes to the eye.
They also have such a giving attitude and nature about themselves, and community involvement and community service is a big part of what Dean McGee is. They provide over $1 million worth of indigent care to individuals across our state, which is absolutely amazing. And they have a global eye care program where they go into third world countries. And so they not only provide training opportunities for the medical students, but they provide eye care to people in third world countries that wouldn't have it otherwise.